Okay, good morning, everybody. Welcome to our first and spring Public Protection Lead Officers webinar. It's great that so many of you can join us this morning. I'm Gemma Ritchie, I'm Adult Support Protection Lead Officer, and I'm here with three of my colleagues, other lead officers for other areas of public protection, who'll introduce themselves when we come to their section. I'm going to finish the section with an adult support and protection input on our theme, which is financial harm and hardship. But first of all, I'm just really going to set the scene by letting you know the thought behind carrying out these webinars and what we're looking to do collectively as lead officers across public protection. As you can see there with this first slide, whilst we've got the theme of financial harm and hardship, we're looking at public protection across the lifespan. So the lead officers and the committees where we do much of our work, we feed into the Falkirk Public Protection Chief Officers Group. And really it's an ask from them that we established our public protection lead officers group, where we've been meeting for about 6 months now, and it is really around how can we improve further the work that we're already doing, working effectively together as part of a whole system approach. We've always had shared membership across our different committees, but it's really self-evaluation around how can we strengthen and improve that further. So it is about that whole system approach, collaboration, making sure we've got robust governance structures, and working together to shape strategy, processes and practice. We're really looking to enhance our linkages across the public protection agenda, and that's recognising children, young people and adults that the living families and communities require us to focus on protection across the lifespan. So that's really what we're looking today, and we felt that actually it was a really important theme, and wanted to start off with looking at financial harm and hardship today. So just a wee bit about the membership. So I said to you there that there's four lead officers that we're coming together today, but we're part of a much wider public protection lead officers group membership. So you can see all the different partnerships and committees that are listed here. So you can expect when we schedule further webinars that there'll be more inputs and a variety of inputs across these different partnerships and groups. And we're also supported by our Workforce Learning and Development Department as well, and you can see some of the roles listed there too. To get us started, we're really thinking about what are our priority areas for focus for this year. And you'll see some of these picked up within the presentations that you're going to receive this morning. We're looking around communication and awareness raising, having this today and you being part of it, and thinking about our participation and engagement is a key part of what we're looking to do collectively. Advocacy and rights is a big theme, our learning and development, performance and data, and our policy and practice frameworks. So you can expect to see some more things coming from the group as we work together on these priority areas of focus. So I suppose that's all really going to see around setting the scene and how we've got here. And with in mind across the lifespan, I'm going to pass you over to Lee Allen, our Child Protection Lead Officer.
Lovely, thank you, Gemma. Hopefully the text's going to work here. We've had some trials, but it's always more challenging on the day. So I'm Lee Allen, I'm the Child Protection Lead Officer, and I'm going to start us off with a bit of an overview of the Child Protection Committee. So the Child Protection Committee sits in the wider context of public protection, as Gemma's described there. Our CPC is a locally based interagency strategic partnership, and it is responsible for developing, implementing and improving our child protection strategy, both across agencies but also within our local community. The committee aims to support staff and members of the public in its collective goal to make Falkirk the best place in Scotland to grow up and to keep all children safe from abuse, harm and neglect. The committee is made up of a variety of senior representatives across all key... Oh, am I back in the room? I just got a wee break there. Sorry, connection issues there. So, the CPC is made up of senior reps across all key areas and partners concerned with the care and protection of children. So we have a wide membership, and that includes reps from education, social work, housing, NHS Forth Valley. We've got Police Scotland as reps on the CPC, and also the third sector and the Scottish Children's Reporters Administration.
Lee, just to pause there,
Oh,
I'm not seeing your slides moving on. I don't know if others are.
oh, can you see them now?
Maybe move it on. I'm just still seeing your title slide.
Who's that?
1 and 4.
Right, that's where I'm at just now. All good?
Yep.
Right, perfect. Okay, sorry. So the impact of poverty on people, families and communities in Falkirk can't be understated. It means that many of our children and young people don't enjoy the same opportunities in life as their peers, and it absolutely prevents our communities from flourishing. Poverty is the root cause of health inequalities, and it negatively impacts on the attainment and life opportunities of our children and young people. And obviously you'll see that statistic there in your slides. So 1 in 4 children in Falkirk experience and live in poverty. But we know that some groups of people are more likely than others to be impacted by poverty. And obviously that includes children. And we can kind of further define that by thinking about certain types of families that are more impacted. So those are larger families of 3 or more children, lone parent families, families where mum is under 25, and also families with a child under 1. So while poverty itself isn't a child protection concern, it can create the conditions that increase the risk of neglect and other forms of harm, such as unmet basic needs, stress within the household and social isolation. We know that there's a disproportionate intensity of child protection interventions that occur in our most deprived neighbourhoods. So this indicates a need to think not only about the family, but to think beyond the family, addressing patterns of concern and supporting positive opportunities in communities. So the promise is Scotland's promise to its children and young people, following an independent care review which was published in 2020. It commits Scotland to transforming the care system so that all our children grow up loved, safe and respected. Our national guidance for child protection in Scotland is really closely aligned with the promise, and it has a big emphasis on early intervention and family support in order to keep children safe and their families where possible. Ensuring children's voices are heard in decision making, and a focus on multi-agency collaboration so that our systems work together to support children's well-being. When we think about financial harm and hardship and how this is reflected in child protection, we can identify varying areas of concern that impact on children, and you'll see some examples there in the slide. So we've got neglect, domestic abuse, child sexual exploitation and child criminal exploitation. And you'll see the definitions there in the slide, which have been taken directly from the National Guidance for Child Protection. And you'll see that each of them have a reference to financial harm and poverty. However, we know that financial harm and hardship can affect families in a variety of different ways, and it can result in a lot of accumulating risk factors. Often these, don't sit in isolation. For example, a child who is living in a domestically abusive household can experience caregivers who use alcohol or substances, and they may well be at higher risk of emotional and physical abuse. So you'll see in your slide, I've listed here some examples of some of the impacts of financial harm and hardship on families. And as I've said previously, we rarely see these impacts in isolation. We often see, these coming through in different ways. So financial difficulties, of course, can create significant stress for parents, and that stress can impact their ability to provide adequate care and supervision for their children. Financial problems can place immense strain on relationships. So that's between parents and their children, but also between parents themselves. We know that this can lead to conflict, arguments, and generally a less supportive family environment, which in turn can increase the risk of abuse and neglect. We also know that perpetrators of domestic abuse can use finances as a means to control their partners, and we know that the impacts of domestic abuse are far and wide for children and young people. So when parents are struggling financially, they may have less time and energy to focus on their children's needs. This can negatively impact on their parenting skills. They may well become less patient, more irritable, and less able to provide consistent care. In some cases, financial hardship can lead to children's basic needs not being met. So this is food, clothing, shelter. All of these things can create stressful environments for parents and children, but therefore increases the likelihood of neglect. Substance use is complex in terms of its impact on children and families. It has significant financial, emotional, and social impacts on children, and these impacts can be both immediate and long-term. We know that adults who have experienced childhood trauma themselves can be more likely to use substances, as attributed to a kind of coping with the trauma or stress. And we know that parents who use substances may have impaired ability to provide adequate care and also supervision for their children. Financial difficulties can lead to social isolation. This can further exacerbate stress, negatively impacting on parenting skills. And we know that children who are socially isolated are more vulnerable to exploitation. Criminals purposely seek out vulnerable children and to groom them. They do this often by creating a sense of belonging and isolating them further from any protective factors in their lives. Children and families, children and families experiencing financial hardship are at higher risk of negative mental health outcomes, poor school attainment, and we know that children living in our more deprived areas are far more likely to experience health inequalities. So that's such as difficulties in accessing dental care as an example of that. Okay, so I'm going to talk to you a little bit now about some data. The CPC plays a key role in ensuring that there's continuous improvement in child protection practice. We have an overview of the quality of work that's been carried out to protect children. We do that by using data, self-evaluation, audit activity and scrutiny with the purpose of early identification of trends, patterns that impact on the safety of children. So we use our data, or we consider our data on a quarterly basis using the national minimum data set. And we also use information from the Scottish Government's child protection statistics to compare our own local data. So in terms of data locally, Falkirk has a higher rate of children on the child protection register than the national average, and that this has been a pretty consistent picture that's reflected across recent years, so we haven't seen much change in that From November 2023 into January 2024, we had 63 children placed on the Child Protection Register. I think it's important to highlight that that's not a static figure and that this does change over time. That will change as risk reduces for some families, and then for others the risks will increase, meaning our child protection numbers may increase. So our data over time has shown, again, a pretty consistent picture of domestic abuse being the most used reason that children have been placed in the Child Protection Register in Falkirk. And during the last reporting period, this actually accounted for 84% in the children in the Child Protection Register. We have 26% of those children had neglect recorded as an area of concern. 37 children were affected by a parent or carer's ill mental health, and 27 had parental drug use recorded as an area of concern. Now, I have said that we rarely see these issues presented in isolation, so it's actually pretty common that we see children placed in the Child Protection Register for more than one area of concern. We can have a child on the Child Protection Register potentially for all four of these areas identified as risk factors for them. So I think it's important to remember when we talk about child protection registration that those children on the Child Protection Register, we are talking about children who are considered the most at risk in our community. And these figures absolutely do not reflect the volume and the breadth of work that's been undertaken by agencies to reduce risk and support children's wellbeing. Moving on now a bit to some local support and intervention. So we know that in order to support families, we need to intervene at the earliest possible opportunity, and early intervention and support at this level is absolutely the most effective way to prevent concerns from escalating to a child protection level. The Whole Family Wellbeing Fund is a Scottish initiative, and it's a significant investment provided by the Scottish Government to local authorities aimed at reducing crisis intervention, shifting the investment towards prevention and early intervention and supporting families in need. In Falkirk, we have a dedicated promise implementation team who are responsible for coordinating our work on delivering the Whole Family Wellbeing Fund, and this is just one component of our joint commitment to keep the promise. So that funding has been used to support and progress over 17 tests for change, and some examples I've included here are implementing a single point of access system for Falkirk that will streamline the process of making referrals, referrals of support relating to mental health and wellbeing. And this should allow us to quickly provide a service where the best agency is already known, but also in more complex cases to allow them to be discussed and to ensure that the right provision is given. The overall aim of that is to reduce waiting times and ensure that nobody is left without support, getting the support to the families when they need it. The initial response team is our front door for children's social work services. They've been successful in securing funding to deliver family-directed support. So this will allow the team to provide financial support directly to the families themselves, who will use it in a way that will provide better outcomes the way that they see. So the family identifying the need and using that funding in that way. The project's co-produced with families, and it focuses on relational-based practice, building on trust and positive connections which empower families at an early stage of interaction with social work, again to prevent escalation. Another example of a test for change is our Dunnipace, West Quarter and Hog Lane community hubs. So the three localities will work together to deliver and support and transform community-based universal youth work. So we've also got I suppose moving on to benefit maximisation. Their services working with families play a key role in signposting to appropriate supports. We've had some excellent work undertaken by our welfare benefits team that has ensured that the take-up rates for a Scottish Child payment is currently sitting at 94% for Falkirk, so that's 94% of children who are entitled to that money, the families are receiving it. That's almost 10,000 children. So a pretty good success story in that sense. So the benefits maximisation team also play a really pivotal role in signposting families who are entitled to grants and free school meals, so ultimately ensuring families get what they're entitled to increase household income. In terms of some support in schools, in Falkirk, the Scottish Government's Pupil Equity Fund, PEF, because we love an acronym, but it aims to help schools address the poverty-related attainment gap. It provides additional funding to support children from the more disadvantaged backgrounds to ensure that they have the opportunity to achieve their potential. So each school has an allocation of funding that they can use flexibly in a way that they identify will support their school communities. A lot of schools in Falkirk have opted to employ like homeschool links or family support workers to bridge that gap between home and school life. And others have used it in different kind of creative ways to encourage attendance in school. For example, I'm aware of a therapy dog being introduced to support classrooms for children who struggle with anxiety around the school environment. So a lot of different ways in which schools can think creatively about that, that will meet their needs. So that brings me an end to my input now. So thanks for that, and I'm just going to now hand you over to Sarah.
Thank you very
Well,
much.
Well, you're
Sorry.
getting organised, Sarah. Just folks, I should have said at the start, there's a Q&A button at the top. So please, if you've got any questions, pop them in there. We might have time at the end to answer those live. If not, we'll draft some responses and circulate at the end. And the webinar will be available as it's been recorded as well. Over to you, Sarah.
Thanks for that, Gemma. And thank you for that as well, Lee. So my name's Sarah Finnegan. I am the Gender-Based Violence Lead Officer in Falkirk Council. And I'm going to talk you through a couple of bits today in terms of how gender-based violence relates to financial harm and hardship. I work as part of a partnership, so the Falkirk Gender-Based Violence Partnership, and we'll all have our own kind of areas of work that pulls together multi-agency partners working within Falkirk and across Forth Valley to think about how we can begin to make an impact in this particular area of work. I just want to start by thinking about what gender-based violence is from the offset. So we use the terms violence against women and girls or gender-based violence quite interchangeably, and they're used to refer to a range of actions that cause some kind of suffering. We use these terms, but despite using these terms, we're not excluding that men or boys are victim to, or that we have females who also offend. It's just acknowledging the fact that we have a disproportionate amount of women and children who are impacted by particular types of crime, but all of that is included regardless of gender within the Gender-Based Violence Partnership and the way we're progressing the work. And ultimately it recognises that gender-based violence is something that damages health and well-being, limits freedom and potential, and is ultimately a violation of people's human rights, and that includes the UNCRC in terms of our children's rights as well. And all of that sits contained under a Scottish Government equally safe strategy, and that's something we're more closely looking to align towards within Falkirk as we begin to progress some of this work. But what does that mean in terms of how we define it? So gender-based violence, as you can see, it's quite a wide range of different types of harm. So it includes things like rape and sexual assault, childhood sexual abuse, exploitation, domestic abuse, human trafficking, and also things through sextortion, for example. So I know that there's been a big push around sextortion in Falkirk and across Forth Valley following an incident, and thinking about how offenders use finances in those contexts. So sextortion, for those of you that don't know, is where someone will be tricked or coerced into sharing a sexual image and then will be blackmailed, or another tactic of harm will be used to get money from a victim. And then thinking about also where that relates into harmful practices such as FGM and our dowry-related violence as well. Why is it important in Falkirk? Well, across Scotland, sexual crimes account for 5% of all our crimes, which might sound like a small number, but that equates to 14,500 sexual offences that are reported to police every year. Now, we know that the underreporting of sexual crimes is significant as well. So thinking about actually the prevalence across Scotland being much higher than that. As Lee's already mentioned, domestic abuse in Falkirk, we do have the data to support how high that level of prevalence is. And across Scotland, out of all the local authority areas, Falkirk is actually the 6th highest for domestic abuse prevalence that's been reported, which equates to just over 2,000 domestic abuse incidents reported every single year. When we think about a domestic abuse incident, it's also thinking about the impact of an individual, but also the entire family unit and sometimes the communities that people are living in as well, and the ripple effect where that reaches. And as Lee's already said, we have 84% of children who are on the Child Protection Register at the moment in Falkirk who are identified as having domestic abuse as a reason for being on that. So unfortunately, gender-based violence isn't something we're escaping anytime soon. We know that it's interlaced with all areas of public protection, and it's really key that we recognise and understand things through that lens in order to really make a difference in all areas of protection. And what this equates to in terms of domestic abuse is that the police are responding to an incident of domestic abuse every 9 minutes. That's the average stat for Scotland, so in Falkirk that's actually a bit higher, which I think is quite striking. So I want to have a think now just about some of the abusers' tactics and thinking about that in the context of finances. And apologies that this slide is quite wordy, but I wanted to break down a little bit about how people will use money or financial means to cause harm. So that first process, looking at grooming through financial means. So many of our abusers will use a false sense of security or dependence, where people perhaps haven't had that before, thinking about how to create safe home environments or where they can lure victims in with gifts or financial incentives. In the case of child exploitations, what we quite often see is a promise to financial independence or life as well. And sometimes we hear professionals talking or discussing children making life choices because they want to be involved in particular types of lifestyles, and that can quite often come alongside money and resource. But really recognising that that is not a lifestyle choice, and that abusers know this and they will use that tactic in order to trick children and young people into thinking that. But quite often, well, what will then happen in cases of child exploitation is that will be then used to create a false sense of drug debts or other kind of debt and keep them trapped in abusive situations. And it's not a life choice. It's something that, you know, if we think about child abuse, and that old kind of example of, you know, I'll give you a sweetie and you come with me, but actually that's a form of transaction. And when we think about it in older children and young people, it's a very similar offender tactic, just to be mindful of. Traffickers will also use a very similar tactic to either promise a better future or think about how to trap victims. So that can be through really minimal wage or kind of tokenistic wages, but creating debt right from the offset. So when people are trafficked for the case of labour, they quite often already have, transport costs, they have the cost of getting a job, they have accommodation costs. So already they have a debt to work off before they have even started work. So moving on to thinking about how restriction of the resources can be used. So if we're thinking about cases of domestic abuse, for example, quite often what we see is perpetrators controlling bank accounts, withholding money, or forcing victims to justify every expense. So where a parent, for example, is needing a new pair of shoes for a child, and they have to justify or ask the offender for that. And the child's go, Mum, please, I just need a new pair of shoes. I'm getting bullied because I've got holes in my shoes. The mum being unable to provide that for their child can induce guilt and lots of really complex feelings, where the parent who's trying to provide actually has zero control over finances. We see tactics by abusers where benefits will go directly into their accounts, or they find another means to manage that. So sometimes when we're intervening as professionals, we look at the symptom of that. So we kind of become curious about why the child has holes in their shoes, as an example. But we need to get better at asking what's behind that and what's going on. And actually, is the parent genuinely in a position to do that, and what might be preventing some of that, and thinking about the offender's behaviour in those cases. Um, Throughout domestic abuse or child exploitation or human trafficking cases in particular, we quite often see that tactic of economic dependence created. So that can be in a multitude of ways, but what that means is that it becomes increasingly difficult to separate or leave harmful situations, because we ultimately need finance to survive. Basic needs are met through financial means, and for a victim to leave an abusive situation, quite often that means that they have no ability to meet their basic needs. And I'll come on to thinking about that in a little bit more detail shortly. Coerced debt and financial sabotage. So we have multiple examples where offenders will take out loans, they'll max out credit cards, they'll take out financial agreements, they will pile on debts to a victim and someone that they're targeting, and really become disruptive in them finding any sense of financial stability or autonomy and independence. So they will phone employers, they will show up at employment and workplaces and create drama or chaos. And what that makes employers quite often respond to in a way is by saying, actually, we can't have you here. And that becomes really difficult. It increases all the shame and the stigma and the blame around these types of harm as well. And that, when someone has no route to financial independence, continues to enhance the control that they will have over a victim. And where we do have opportunities to create safety for victims, that will quite often result in threats and retaliation from offenders who are in a position where they're losing control over the person that they're causing harm towards. So they will leverage, finances as part of a threat or retaliation. We've seen people lose homes, and that be actualised through courts, different types of ways of punishing, through removing money, access to childcare, for example, that was part of employment support, and really limiting what someone can do. And I think it's important to think about abusers' tactics in that context, because where we don't have an abuser, we don't have a victim. So all our responses go towards what can we do to support victims or survivors into spaces of safety and out. But we can't do that in isolation. We need to remember that without looking at what abusers are doing, we're always going to be missing the mark. Thinking about the impact on survivors, as I've just kind of talked through, we've got the reality of the consequences for people who are looking to leave harm. So those can include things like genuinely facing homelessness, and systems where they are perhaps not entitled to, or they have a process to go. For people who are involved in the homelessness process, who are escaping domestic abuse, what that can quite often mean for them is they have to lose their friendships, they lose social networks, they have to move schools or jobs due to relocation. They quite often lose access to things like cars or childcare, and all of this has an impact on employment and things as well. And I've already touched on things like survivors of trafficking who already have debt before they've even started working. And those are ways of continuing to be trapped in harmful and abusive situations. They don't have a choice within that space. When we're looking at long-term financial devastation, so where we might have a survivor who's considering moving out of spaces of harm, what that quite often will mean is that they have to face the reality of their financial situation. That can be ruined credit scores, it can be accumulated debt, it can also be things like legal issues and criminal charges that stem from those coerced actions. So in the context of child exploitation, for example, we might have children who are facing drug charges as a result of their abuse, and we need to be mindful that those charges can have an impact on future employment and opportunities, and really understanding what sits behind that and how we shift that pattern for children and young people who deserve future. And then for, if we think about people leaving situations of domestic abuse, if they have ruined credit scores, they're not entitled to benefits, they're trying to work, but actually they might not then have enough to be able to rent somewhere or to get a loan to get back on their feet. And those are really difficult. And that's in spaces where we're not even considering meeting basic needs. But for most people, I would say, who are leaving harmful situations, the financial impact is really a barrier to any form of recovery, because what it continues to do is keep people in a survival mode where people are having to just meet basic needs such as their day-to-day food. If abusers have used the tactic of getting someone addicted to substances, or substances is the way that someone copes with the harm that they're experiencing, that is also a way of entrapping and creating financial debt. But also when the access to that goes from the harmful route, can become something that people seek to find. So when we're looking at the basic day-to-day needs for victims, families, it keeps people in survival mode and really prevents that next stage of recovery. And our victims may also struggle with economic independence due to lack of opportunity, education, and that employment history as well. So if they've lost jobs through, police reports and crimes or court cases, or just not being allowed to go to work and being prevented from leaving the door, or their car keys have been stolen, or whatever it is, then all of that impacts their future employability as well. And when we don't have those opportunities to have financial independence and security, steps to safety become really difficult. And that impacts not only on victims, but it impacts, as I've said, on families. So just as Lee was talking about in terms of child protection, we think about that in terms of intergenerational consequences as well. So where we have children born into families who are struggling to meet basic needs, children are also in a space where they're trying to survive. And as we think about they grow into adulthood, and potentially targeted by abusers who are saying, actually, we have a different way of life for you. We have something to offer you. This can be, here we've got access to money and resource, and are groomed in that way. We can quite often see intergenerational consequences, not only of the harm, but also of the poverty that runs through. So thinking about steps to safety. So we know that financial harm and control are very interlinked with forms of many types of gender-based violence. And we need to cover lots of areas to really make a difference around this. I'm not going to go into detail about legal protection and policy changes today because I don't think it's particularly relevant, but it's just to note that we do need to look at better criminalising exploitation cases and getting those bits through, really making a difference with financial institutions and making sure that protocols and things are in place, as well as strengthening our laws overall to really make a change. But there are things that we can do in the midst of this as well, without those bits. So awareness and education is key in many spaces. And what I would say is awareness and education for people who are experiencing harm is absolutely key. But we also need to remember not to limit it to saying someone needs to better understand what they're going through and that that's enough for them to be able to leave the situation they're in, because that is not the case. Abusers use tactics that are very skilled and very controlling, and awareness is only a very small part of that broader picture that's needed for steps to safety. So, but what we can do is look to upskill survivors in terms of understanding numbers, financial literacy. What does a credit score mean? Actually, how do you pay rent? We worked with an older adult who had never paid a bill in her life because her husband had always had control entirely of all of the finances and everything that went in and out of the house, and she was given, a very small allowance. So when she was looking to find her steps to safety, had no idea of how to function in a financial world. So lots of information and learning had to go into that space to allow for that. Thinking about access to financial resources. So I talked a little bit about keeping people in a survival mode. We as professionals and workers and in systems need to support people to not have to be in that survival mode when they're looking to meet basic needs. So that's helping people to access things like emergency funds, food banks, not always with them having to ask us for those bits, but just recognising that that is quite often an inherent part of what they're going through, and we can table that with them to help bridge that gap and reduce some of the stigma around that. Also thinking about employment opportunities. So whether that's through kind of building skills, training opportunities, or whether we've got links into different programmes that can support people to get back on their feet as well. Financial independence, you need basic things to achieve financial independence, and many people who've experienced harm and significant control won't have things like their own bank account. So making sure that the building blocks are in place to really help them to do that as well. And ideally, we would also have specialised financial support services for survivors. We aren't in a place where we have many of those around Scotland, but I do think that initial financial support in the beginning can have a really significant impact on someone's recovery longer term. So that would be something that would be really nice to see grow across Scotland. And then thinking about our support networks and community involvement. So thinking about how do we increase and expand survivor support groups and really foster that financial resilience, allowing people to share and partner with safe working environments who understand contexts that people are trying to build their lives from, but also where you can pool financial resources together as well. Okay. And I am going to end there and pass you over to Phil, who is our Alcohol and Drugs Partnership Lead Officer.
Thanks, Sarah. I was just going to give you 2 minutes, Gemma, to come in if you wanted to, but that's why I paused there for a little bit, but I'll crack on. So I need to take control of this, don't I? Got it. Right, has that moved on for everybody?
It has.
Yeah, great. Okay. So my name's Phil. I'm the ADP lead officer, and really appreciate everyone logging in today. I hope that people get something interesting from the session today. Already there's been quite a lot of cross-cutting talk. So listening to Sarah there, she was talking about a lot of the things that impact on substance use as well. And I think it's really easy or tempting to compartmentalize people's experiences into various different points of their life. But this is about looking at people in the whole, and where people are affected by substance use, that probably has an impact on other areas of their lives as well, and will lead to other areas of their lives. So it's really important not to compartmentalize. It's easier for us to do it like this because it works as a webinar. But if people can take it all in the whole, that would be helpful. So my role is lead officer with the Falkirk ADP. For those who've read my bio online, you can see I've been working in substance use for about 25 years now, which terrifies me, in a range of different roles. I started off as a volunteer. I've been through a drugs worker. I've worked in needle exchanges. I've managed services. I've put together multidisciplinary hubs. I've worked as a policy officer with one ADP, and now I'm a lead officer for the Falkirk ADP, and I have been enrolled for nearly 3 years now. One of the most startling revelations that I've experienced while working in substance use is that very little of the work is about drugs and alcohol. It's more about, which sounds counterintuitive, but it's more about community and deprivation, poverty, isolation, absence of opportunity, lack of hope, lack of aspiration. And I think we'll have a quick look at that a bit later. But first, just a brief overview of what an ADP is, because I think ADPs can sometimes be a little bit nebulous and sit off to the side of the main picture. So an ADP, an Alcohol and Drug Partnership, is a committee of senior representatives from across the Health and Social Care Partnership, local authority, the NHS, third sector, emergency services, education, prison, that kind of thing. The ADP executive is tasked with reducing drug and alcohol related harm in the local area. It's funded directly by Scottish Government. So each ADP is funded directly by Scottish Government and reports to the IJB, the Integration Joint Board. So it comes under the umbrella of the Health and Social Care Partnership, but is funded by a different direction. The ADP is supported by an ADP support team, which is myself, and we've got 2 development officers. One is out for recruitment just now for those who may be interested in working with the ADP. A little plug there. So the support team acts as expert advisors, I guess, to the executive and implements any work that they direct. So the front-facing part of the ADP is the ADP support team, and the backroom, more senior, is the ADP executive. Excuse me. So how do we work? So we work to a number of different local and national strategies and policies. The main ones, I guess, for Scotland is rights, respect and recovery, which is the main drug policy that came out in 2018. And alongside that, there was a refresh to the alcohol framework. Now, those 2 documents, I guess, are the blueprints by which all ADPs function. Those documents contain all the main outcomes that each ADP will want to align any of its local work to. There's also other documents and other policies and other bits of work that come into that, such as the National Drugs Mission, which some people may have heard about, the MAT standards, and then coming a bit localer, we've got the Falkirk plan, the Community Planning Partnerships, local outcome improvement plan. We've also got the NHS Forth Valley delivery plan that we work to, and at the moment we are in the process of developing the ADP strategy for the next 3 years. This is quite an extended piece of work, and we started it off last November with a big needs assessment, which is still ongoing. So we're looking at basically what is available in Falkirk, what's working, what could be improved, what's missing, where are people falling out of the treatment cycle, are there effective treatment pathways, exit strategies, the whole lot. Once that work's complete in the summer, we'll be doing quite a few stakeholder engagement sessions to develop our 3-year strategy. Along with that will come a commissioning plan and a delivery plan as well. So quite an important year for the ADP, and one that will set us on the road for the next 3 years with our outcomes. Again, if anybody wants to get involved with that work, then I'm more than happy to include you in the stakeholder engagement sessions. I think that if we can get as wider an input as possible, that would be great. So there's a few other aspects to what an ADP does as well. I've mentioned the funding. We commission key services. So we commission the third sector Change, Grow, Live service. We also contribute money to the NHS substance use service, formerly known as CADS. We also fund the recovery community, and we contribute bits of funding to the family support service, SFAD, and other different projects around the area. Now, it's important to highlight that the ADP doesn't fund everything. There's a significant number of services that contribute to the ADP agenda, which are funded through the Health and Social Care Partnership as well. So it's not the be all and end all, but it is the main kind of driver for the strategic change. Yeah, we report, if anybody's interested, we report to various different places, including Scottish Government, the Public Health Scotland, and locally to the Community Planning Partnership, the Chief Officers Group, and the IJB. Right, let's see if we can move this slide on. There we go. Right. So just before I start, we will be touching on drug and alcohol deaths later, and it's always really difficult when you're talking about that thing, because it's hard to do it without seeming like you're reducing everybody to a statistic, and that's not the intention. It's easier to present and to kind of give an overall impression when statistics are available. But I think it's really important to recognise that, you know, deaths from drug and alcohol are avoidable, and it's a big part of the work that we do. Also, it's important to recognise if anybody's triggered by any of this discussion, then happy to chat later, or just make sure that everybody's safe when they leave the room today, because it is a really emotive subject when we talk about death in any of its forms. So, financial harm. Now, I'm quite lucky to come on after Sarah and Lee, because they've already done the most of the work for me. They've highlighted a lot of the additional of the various forms of harm that come from substance use, as well as other areas of what the lead officers are involved with. So it's important to recognise that substance use as a term is a cover-all term that's used to describe many situations in which people use many different substances. And within that term substance use, you've got the recreational drug user. You've also got the chronic, ingrained, endemic, intergenerational drug use that goes on as well. So it's a bit of a woolly term, I think, substance use, and we need to be clear what we're talking about, because each one of them, those aspects, brings its own kind of body of harm, if you like, along with it. And it's really easy to conflate these different situations. So we need to be clear about what we're talking about here. People can use substances recreationally, habitually, inquisitively, medicinally, socially, solitary, and so on. But all of those have an underpinning of harm. And all substance use can bring on harm, whether that's financial, physical, mental, familial, relational. Just for this webinar, because there's so much here to talk about and we could spend all day, I'm just going to concentrate on some of the key aspects and highlight some of the key aspects. So if we look at the list there that I've got in front of us, we've got top of that, impulsive spending and debt. So I think thinking about the not the more ingrained chronic endemic type of substance use that we see going on in our communities, but the person that maybe can hold down a job that goes out partying at the weekends, and maybe every so often will buy a wrap of Coke or a wrap of Speed or whatnot. And that in itself, it doesn't come with that much financial harm to it if that person is able to support that. But that's a misnomer, because quite soon what can happen, and what generally does happen, is those 2-day weekends turn into 3-day weekends turn into 4. People can't turn up for work the next day. So it kind of snowballs a little bit. You get loss of employment. There's a strain on family finances that come from that. There's an impact on government welfare. So we're going from individual financial harm to societal financial harm as well, which includes the economic impact on communities. With that, if people can't support themselves and their families, then there's an inevitability that crime will increase. So shoplifting, crimes of opportunity, housebreaking, these kind of things. And again, that's a drain on local police resources, as well as the devastating impact it can have on the people whose house or property is being broken into or stolen. Sarah mentioned quite a bit about coercive control, and again, that really does impact on substance use when we're considering substance use as a financial harm, because not only is it about one of the partners administering another person's drug use, but it's also about them controlling it as well. And that comes with all aspects of what that means, including the financial aspect, the exploitation as well that Sarah touched on. I won't go through again. And obviously the cuckooing and homelessness. So cuckooing, for those who don't know, it's a bit of a strange term. It relates to people that will take over a vulnerable person's house and use it as a drug den or a drinking den or a place to deal from, and basically that vulnerable person has got either the can't think of the word I'm looking for, but they will either be homeless or they will just have to put up with it. Either way, they are very vulnerable, and either way, it's impacting on them financially as well as many other ways. So I'm just going to take a drink of water, mouth sticking together. So why do people use substances? Again, I want to look at the main drivers of substance use here, and these aren't all of them by any stretch of the imagination, but these are the ones that I think people will probably be more familiar with. And we're talking here about chronic substance use. We're talking here about that endemic, ingrained, habitual substance use that people, where people use substances as a form of escapism to quieten the mind, to relieve the emotional, mental, and sometimes physical pain of the past experiences. So past trauma has got a lot to do with this. And again, both Sarah and Lee touched on some of what that could actually mean in terms of past trauma. We get a lot of people, when I was working in drug services on the front line, most of the people that came through the door seeking help and support started off their drug using in their early teens and sometimes pre-teen. And a lot of them had started to use as a way of escaping quite a traumatic environment that they were in, whether that be through abuse within its many forms, or whether that be through poverty in the local area or in the local household, or whatever it may mean. So past trauma is a really key aspect of what drives people to chronic drug use. Within that, you've got their adverse childhood experiences. There's also poverty and deprivation, which is a really key one, and it's quite an interesting one as well. We'll come back to that. Self-medicating. So, a lot of people use drugs not because they want to get high off heroin or anything, but because it does something positive for them in a way that you would expect medicine from the GP to do something positive for you. So a lot of people suffer from anxiety. A lot of people suffer from pain. A lot of people want to control their mood. Now, if you don't have access to GPs, or your GP doesn't want to work with you in a way that you would find beneficial, it's really tempting and really easy to seek out these medications yourself. Unfortunately, a lot of these medications that do control anxiety, do control pain, and do alter mood are addictive, and people get into a cycle where they are buying to support this. They're also having to increase the dosage because they're getting used to it. And again, this can snowball very, very quickly and have a huge amount of damage along with it. Peer influence is also another one as well. We're seeing a lot of kids these days with the vapes in schools. And one main reason for that is because the friends are doing it. So peer influence is a big driver of chronic substance use. And recreation. It's important to remember that, people use drugs because they feel good, and it makes them feel how they want to feel, and they enjoy it. And that can be true for when people start using drugs. But again, very quickly, it snowballs into something else entirely. And can be very, very damaging. Now, if we just come back to poverty and deprivation, because I've put in brackets after that cause and effect, and that's really important because that kind of underpins what I'm going to be speaking about here. It's interesting because financial harm is both a driver of and a result of substance use. So in the last slide, we looked at different of how substance use can impact on people's finances in different ways. But poverty is more endemic than that. It's more ingrained. And just to give an example, I used to work in South Edinburgh in Niddrie. I don't know if anybody knows Niddrie. A few years ago as a drugs worker. And this is where I realized that in order to help people improve their outlook, you had to move past the substances. Drugs and alcohol were actually a really small part of the problem. It was poverty. It was a lack of opportunity that was baked into the community psyche for years and had led to intergenerational substance use. I was working with people whose fathers and grandfathers before them were also on methadone prescriptions, and that was just accepted as the inevitable in that community. There was, and a lot of this stuff is a result of political decisions made back in the 1980s, which led to mass deindustrialization, which left strong communities without employment opportunities. The neglect and the lack of social regeneration over the years has since compounded this to the point where some areas, especially in areas of Niddry, were kind of considered no-go areas unless you live there. Also, with that came a lack of investment in these local communities, a lack of services such as GP surgeries, other health and welfare services, which just made matters worse, and it became a ripe area for substance use to take hold. And this is what we're dealing with at the moment, at the more serious end of the scale: ingrained poverty without an exit pathway for people trapped there. And this was evident when I was speaking to people who came into the service. They couldn't see or envisage a future outside of their community, and substance use was just an accepted part of life. The related harms were often taken as inevitable but unavoidable, and poverty just was. I remember in Niddry, which is part of a wider community called Craigmillar, the community and the people within it were absolutely beautiful, and there was a real strength of community values within that. But it was just accepted as inevitable that this was what happened because there was no local industry. It had been taken out. So the place where people had worked for many, many years wasn't there anymore. And what it really illustrated to me the idea of the strength of this community was one guy I was working with at the time. He wanted to go swimming. He wanted to start swimming as part of his recovery, as part of his treatment. And if anybody knows that area of Edinburgh, the Commonwealth Pool is just up the road. You could probably walk to it in half an hour, but he completely disregarded that because it was outside of his community boundaries. And so I think it's important not to underestimate the strength and the kind of the walled off nature of some of these communities. If we want to help regenerate these communities, we need to do it within the community. We need to provide the services within the community that needs them, rather than ask people to travel to different areas, because quite often they won't. And that can be quite frustrating for everybody. So poverty and deprivation as a cause and effect of substance use. There is policy evidence that attaches to this as well. So I'm just going to move them on again if I can. So there's a couple of quotes there from a couple of documents, policy documents. So some of you might have heard of the Drug Death Task Force, which was set up by the Scottish Government a few years ago to try and tackle the rising drug deaths that we're experiencing in Scotland. And they released a final report called Changing Lives. And part of that, one of the recommendations within that was the Scottish Government must prioritise tackling the root causes of drug dependency, embedding this focus into work across government to address poverty and structural inequality. So there's a recognition there that poverty and structural inequality are some of the root causes of drug use. The Scottish Drugs Forum written evidence to UK Parliament there. Key social drivers include relative poverty and inequality. Problem drug use is clearly closely linked to poverty. So again, these major principal reports that are being written just now and over the last few years are all pointing to poverty and deprivation as being the key drivers behind drug use. The next slide illustrates the impact of poverty. I'm reading this, so bear with me. My eyes aren't that great. Visually, the next slide will illustrate the impact of poverty and deprivation has on the ultimate substance use harms, death. So let's have a look if I can move that on. So alcohol-related harm. So we'll talk about alcohol separately from drug-related harm. So you can see there's two graphs. Now, these graphs are from the Public Health Scotland Observatory website, which is a really great website if anybody needs to find some national trend data. It's scotfo.co.uk. I think. I can't remember what the full address is, but it's easily findable online. And you can look at a range of different public health related statistics by local area, including health board area, council area, or ADP area as well. These are the alcohol-specific deaths by SIMD quintile. So SIMD is the measure of multiple deprivation, the Scottish Index of Multiple Deprivation. And what that does is it maps out areas in Scotland by their level of deprivation and poverty. And you can see from both of these graphs that the most deprived areas lead to have the most deaths due from alcohol. So in the first graph, the line graph, this is really interesting because it actually goes down. The numbers of deaths attributable to alcohol-specific reasons actually reduces over the years from 2002 to 2023. However, they still remain massively increased over the deaths in the most least deprived areas. The bar chart next to it again illustrates that quite impactfully, and this is 2019 to 2023, and you can see the difference between the deaths in the most deprived areas compared to the least deprived areas of Scotland from alcohol-specific deaths is enormous. And that tells us something. That quite clearly illustrates the fact that, you know, substance use is related to poverty and financial harm. If we move on to the picture that we see for drug-related harm, it's very similar. However, the picture when it comes to the trend is rising rather than depleting. So that's interesting. So we need to ask ourselves why is that? Why are more people increasingly dying from drug-related harm but reducing from alcohol-related harm? Is that linked to the National Drugs Mission? Is it linked to minimum unit pricing? Is it because the focus on over the last 5 years has been on gearing up local services to deal with drug problems, and alcohol has taken a bit of a backseat? So there's got to be a reason in there. So there's a lot of unpacking to do with that picture. But again, if we look at the bar chart there, the snapshot from 2019 to 2023, the most deprived areas massively suffer the most drug-related deaths. And it's said that if you live in an area of high deprivation, you are 15 times more likely to die from a drug-related death as if you lived in one of the areas that's least deprived. So again, there's a significant correlation there between our areas of high deprivation and what is happening in those communities to linking up with alcohol and drug-related harm and death. So I'll just move on. Bear with me. All right, there we go. So I'm going to wrap up, but I was thinking when I was pulling this together, because there is so much variance and so many topics to get your teeth stuck into with this, that again we could be here all day talking about this. And I just wanted to think, what was the one thing what's the one message I wanted people to take away from the ADP section, having only given a very brief overview of the issues. And I was hoping it would be that relational link between poverty and substance use and how it acts not just as the cause, but also as an effect. It colours many aspects of people's lives who live in poverty. And especially when that poverty is intergenerational and community-based, it brings with it a lack of opportunity and a lack of hope, lack of aspiration. So to tackle the many forms of harms that substance use brings with it, we need to concentrate. It's evident we need to concentrate on our communities. We need to rebuild them. We need to improve service access. There's no point in citing a drug service in one area if people from the area that need it can't actually reach it because they can't afford the bus fare. So we need to be careful about where we're positioning our services. We need to nurture local industry. We need to and other employments and opportunities. And all the other stuff that the other lead officers have already spoken about today. As I said right at the beginning, the ADP at the moment is undertaking its needs assessment, and this is the stage where we find out about our communities in Falkirk, because a lot of the stuff we're talking about today is national stuff. It's trend data from across the country. We need to know and be more confident in what's happening locally, in terms of our communities, how it links in with the areas of work of the other lead officers, and how we can kind of work off each other and work with each other in order to improve experiences for people. So I think that was really my kind of intention with this piece of work today. It was to highlight that link, and really kind of get people thinking about the people they work with and where do they stay in their communities, and what does life look like for them. So with that, I'll thank you for your time. I'm always available. I'm really easy to find. My email address is on where it should be. So have a look and get in touch with me. And I'll pass back to Gemma. Thanks.
Thanks so much, Phil. So I'm the last lead officer today, folks, and we've moved our way through the life course. My input is going to have a bit of a focus on older adults, but we've already touched on it. Speakers that have come before have talked about intergenerational trends and themes, and it's really about that focus around people existing within communities and within families. Just some reflecting on some of the things that Phil was saying there around, I think sometimes the term that's used at the moment is contextual safeguarding, isn't it? It's about thinking about people in their communities. And I could see Lee nodding as Phil was speaking there just around about that. And I think that's around some of the initiatives that Lee was talking about the different ways the whole wellbeing family fund's being used in different areas of Falkirk around Dunny Pace and Holgen and Wester Quarters. So, and the other link I was making when we were thinking about that is there's lots of work being done in the health and social care partnerships around locality plans at the moment. So we're looking at central locality, and then we're going to be moving on to look at east and west. So it's about understanding our communities and what are the particular issues, the strengths, and the other things that we need to focus on in our communities. Just starting off with that, folks. So all the speakers so far have talked about our community advice service, hugely important service locally, and it's made up of our welfare benefits teams and our debt advice team. I'm actually going to meet them at their team meeting this afternoon at the Foundry. The supporters and input at our Adult Support and Protection Conference this year in February. This is one of the slides that they shared, and this is really starting off around about that income maximisation. So they presented data around pension age service users or client that they've supported, and you can see here this is based on locality areas here. The yellow bar is just there's maybe been somebody out with area that's been supported, but you can see here for our west, central and east localities the level of support that they have provided to older adults 66 and above. So the number of people assessed by the Welfare Benefits Service, and this is from April 2024 until they presented at our conference in February. So it was a total of 523 older adults with a total gain of more than 1.4 million, averaging around 2,725 gain per adult. So, if we're thinking about health and social inequalities and just making sure people have enough to cover and keep themselves well. One of the areas that we do get types of harm that are reported in through adult protection is self-neglect. So wherever we can identify opportunities across the lifespan, we've covered it around children and families and adults who are using alcohol and drugs, but involving and making sure we're identifying those opportunities for older adults as well. You can see just the level of income maximisation here that's happening. And what I'm hoping when I'm going to meet them this afternoon is actually often we see there might be harm that's hidden, and there's lots of different services who have direct face-to-face contact with adults. So I want to really support them to make sure that they are recognising public protection concerns, so that when they have contact with families and individuals, they're well supported to make referrals into our service. So when we're thinking about financial or material types of harm, and this is across, so adult support and protection, we're talking about 16 and up. As I said, I'm going to have a bit of a focus on older adults. However, many of these types of harm that are listed here, older adults, and you'll see for the slides that I'm about to present, have added vulnerabilities because of frailty, because of cognitive impairments that can be experienced by that age group. But it's just worth saying that this can be across different age groups. When we were preparing for this presentation, we were reflecting that actually it was really good. Many of you might have seen this, but 24 Hours in Police Custody had a specific episode that was related to an older man in a care home and his niece who it was theft of thousands of pounds of his money, and that niece, she had her own mental health difficulties. She had difficulties with substance use as well. So it was just a really good example to raise public awareness around some of the issues. And it's not an uncommon scenario for us to be investigating, our council officers to be investigating, where we've got financial harm of an older adult who is resident in a care home. So you can see that here within the boxes here, there's a box second from the right there that's also got misuse of personal allowance. So unfortunately, we can sometimes see situations where, older adults don't have the basic things around toiletries, and, if they want to get their hair cut or a newspaper, they can be denied these things. But there's a broad range here, and I think this is just quite a helpful slide for you to think about and take away when you're thinking, what is it that I'm observing, and what is it that this could be? What type of harm are we talking about here? So a wee bit of data just to sort of bring it to be real for Falkirk. So I've had a wee bit of a deeper dive into financial harm investigations that we've carried out as a local authority between April and December last year. So I examined 104 referrals for older adults where the primary type of harm was financial harm. Now, it goes without saying, and Sarah covered this really quite nicely, that actually it's often not in isolation where you've got financial harm. Commonly there's psychological harm and other types of harm as well. And these were referrals where our council officer had used their investigatory powers, so they'd visited, they'd interviewed, and commonly with financial harm there'd be an examination of records, bank records. So to give you a wee bit of a flavour around those 40 referrals, you can see here some of the risk factors with the service user groups for these older adults. So, it's not always about somebody being unaware or not able to understand or weigh up, because you can see actually there that the highest bars are for physical disability, infirmity, and frailty due to age. So somebody might very well be able to understand or make decisions around about something, but it's actually their frailty and their ability. So commonly these situations were where somebody maybe couldn't get out to purchase messages, their grocery shopping, or do, their activities of daily living. And they trusted somebody with their bank card, for example, who had then taken their money, or had theft, or had taken a bit off the top without the adult's knowledge. Closely followed there, well, you can see down the bottom there, other risk factors are sensory disability. So it could be sight or hearing or some other sensory impairment that are a risk factor. Substance use was a factor within older adults as well. But then you can see closely followed by physical impairments or dementia and other mental health conditions as risk factors for the service user groups. And sometimes, as we know, with our ageing population, somebody may have had frailty and mental health difficulties as well. So, types of financial harm and exploitation, sort of linking us back to that grid slide where it was highlighting them all. And again, it wasn't always one single type of financial harm. So there was straightforward theft, you can see there with the biggest bar. There was exploitation. There was improper use of funds, this idea of inheritance impatience, taking it, it's coming to me anyway, but actually not having a discussion or having any consent or authorization given from the older adult. Non-payment of care home fees. There was abuse of legal appointments, so embezzlements of people who are appointed as power of attorneys. There was quite a bit of evidence of undue pressure, controlling or coercive behaviour, and failure to provide care as well. So where somebody was in a caring role, that actually there was lots of evidence within the cases where the adult wasn't living in very good home conditions, was doing without, weren't living in a cosy home and had good nutrition. So, there was that failure to provide care or withholding or controlling access. So a broad range there, folks. Now, many of you on the call who are involved in some of these investigations won't be surprised to hear this, but I think this is one of the reasons why we really need to raise awareness within the workforce and also within the general public, because whilst there is fraud and scams and there's that harm perpetrated by strangers, it's not what we see coming through adult support and protection. It's people who are in relationships of trust. It's people who have got a connection and a relationship with that adult. As you can see there, adult child was by far the highest alleged perpetrator of harm. Grandchildren, adult grandchildren, extended family, friends, neighbours, and power of attorneys. So these are existing within relationships, and which makes it more challenging for the older adult around how would they disclose or let somebody know what might be happening to them, if indeed they were aware of what was happening to them. So this is really the profile around about this, and we tried to raise awareness of this just during National Adult Support and Protection Day. What I would say, I've not got a slide in here about it, but there was a really, really good evidence of multi-agency referrals, so people recognising harm and reporting it in, but by far the highest referrer was our care and support at home organisations, so social care providers that were going into people's homes. They were building relationships with older adults, and either the older adult was disclosing to them what was happening to them or what they suspected was happening to them, or the worker going in to deliver care and support spotted the signs. Okay, so joint investigations. I would say probably when we're looking at different types of harm around adult support and protection, it's the area where we most commonly carry out joint investigations with Police Scotland. As you would expect, some of those acts that I was describing there, theft and embezzlement, there can be criminality there. So we work closely with our public protection unit and the adult support and protection investigation team. They do some excellent work and really explore justice options for older adults in these situations. It's not always the pathway. Sometimes it is about was there criminal intent? So you can see mens rea there. So when people were carrying out the behaviour, was it their intent to steal from the adult, around about all the different things that I've explored there, and can be evidence that it's been a criminal act as well. So there's lots of different checks and balances that can't go into detail today, but the Police Scotland will be utilising when they're carrying out criminal investigations. But a lot of it is about, and this is where we come into our joint investigations, is examining past behaviour, and is it helping? Is it taking? Has the adult consented? What I would say, out of the 40 investigations that I looked at, we didn't find that all the older adults were subject to financial harm. Some of them it was, to consenting adults, and there was a bit of support within families for all the reasons that we've already explored today. People experiencing difficulties throughout their life course, experiencing poverty and hardship. It's to be expected within our relationships that people are going to support and help each other out and consent to do so at different times. So that's not what we're talking about. We're talking about where the adult isn't aware or isn't comfortable or is being controlled or unduly pressured, and it is financial harm. So it's about making that distinction, and that's the skill of our council officers and our colleagues, when we receive reports of financial harm, of distinguishing between the two and supporting people to be educated, to have healthier relationships. And Sarah touched on in her presentation just that the importance of working effectively with alleged perpetrators of harm or perpetrators of harm. We've got to do the both, and it's very important within this area of harm and financial harm that we've got to understand people's context, why they're in this situation, and we need to support them. Whether to have those healthier relationships or to have the resources so that they're not in the position where they're harming other people within their networks. Because the impact and what we see for older adults, it can be devastating. It really can be devastating. It can be devastating for the larger family network. So there's the financial loss. I mean, it can be thousands of pounds, people's life savings. The loss, the grief, the shame, if it's happened within a trusted relationship, the loss of that relationship, it can have impacts on their housing, their accommodation, their placement. And undoubtedly it has effects on their physical health. We know for ourselves just how linked our physical health is to our mental health. And it's a real factor here. Loss of relationships. We really want our people to be safe and together, and where we can support those relationships and intervene effectively with alleged perpetrators of harm. It's very important to avoid the fracturing of a larger family network. People are at the later stages of their lives, reflecting, and there can be a high proportion of isolation within our older adult communities. So we want to support them with healthy relationships wherever possible. So next steps, strengthening practice. As I've said, there's lots of great practice happening in this area, from the income maximisation that I started off with the beginning of the presentation, with all of the recognition and referrals being made into the local authority, and then those skilled investigations being carried out by our social workers, our police colleagues and wider partners. But we want to really strengthen that further. So we want to harness that continued partnership prevention work. Make sure that where there needs to be a referral, that people are recognising the indicators and making referrals. We're planning some development sessions for the people that are carrying out those investigations, and some improved financial harm guidance for council officers as well. Improving our use of chronologies. Often when we receive referrals for financial harm, there's commonly can be one or two before, so it's just about us capturing that and thinking how we use chronologies, or even just around the onset of particular conditions as well, and public awareness raising, as I've already mentioned. Now, I think we might be bang on time, folks, because that brings us to the end of our webinar. We hope that you found it engaging and interesting, and that it's focused on a particular topic and that you've seen how it relates and that golden thread going through the four areas of public protection that we've covered today. Last reflection from me, I've very much enjoyed it. It's been great to do that work with other lead officers, and we look forward to planning the next one and letting you know about when that'll be happening very soon. Thank you, folks.